Welcome to the deep dive. Today we're digging into something really practical, preparing for interviews. Specifically, if you're looking at, say, a clinic assistant role.
Yeah, finding the right person for that job, it's absolutely foundational for any clinic running smoothly. And, for you, the candidate going in prepared, that's like half the battle, really.
Totally. And to help us get sharp on this, we've been looking at a really useful article. It's from the Kaplan Community Career Center.
hmm So our mission here is basically to unpack what this article tells us. It lays out some, pretty common interview questions for clinic assistants. And crucially, it suggests ways to answer them. Gives us a peek into what employers are actually looking for.
Okay, let's get into it then. The article, it kind of starts by saying, look, employers really need someone capable, someone who can just slot right into the team. It's a vital role.
Oh, it really is. Yeah. And this Kaplan article, it points to 6 specific questions you're probably going to hear. They're not just random questions either.
Yeah.
They're designed to figure out if you have the right qualities.
Right. So let's jump into the first one. It's a classic opener, Tell us about your previous experience.
Yeah, the standard kickoff, they want to get a picture of your background, basically, see how it fits what they need. The sample answer and the source, it focuses on hitting the really relevant points.
Like mentioning you've assisted physicians with patient care, maybe you handled scheduling, billing, that sort of thing. And the admin tasks, too.
Exactly. And what makes the example good, I think, is the specifics. It's not just vague stuff. It talks about concrete things like filing, data entry, and it even gives an example like worked at XYZ clinic for 3 years. That kind of detail, it just makes it feel more real, more solid.
Okay, so next. Here's where it gets maybe a bit more revealing, testing those soft skills. Question 2. How do you handle difficult patients?
Yeah. This one's huge in a clinic setting, right? It's not just like basic customer service.
Yeah.
It's really testing your cool, your empathy, your professionalism when things get tense. The core approach, the article suggests, staying calm, staying professional.
And listening, right. Really listening to what they're saying and addressing it respectfully makes sense. You got to validate them first.
Absolutely. But this is important. The source adds that other layer.
Yeah.
You need to know the clinic's actual procedures for this stuff.
Yeah.
And crucially, know when to, pull in a supervisor or other staff. It shows you can handle the people side and stick to the necessary rules for safety and, well, getting it sorted.
Okay, building on that idea of tricky situations, question 3 gets into the pace. How busy clinics can get. Tell us about a time when you had to multitask and prioritize tasks in a fast-paced environment.
Yeah, this is all about performing under pressure. Can you keep your head when everything's happening at once? They want to see you don't just, freeze up, that you can actually think clearly and make decisions.
The article it paints a picture of like a particularly busy day, patients back to back, maybe multiple urgent things popping up all at once. We can kind of imagine that, right?
Oh, definitely that feeling of, controlled chaos. And the key things in the sample answer are 1, prioritizing, figuring out what needs doing now versus later, and 2, talking to your colleagues, communicating effectively. It shows you get that it's a team effort, especially when things are hectic, to make sure patients get what they need quickly and safely.
Okay, question 4. This one steps back a bit. Asks about your why. Why do you want to work as a clinic assistant?
They're looking for motivation here. Is this just like any job for you? Or do you actually connect with the role with healthcare? The sample answers in the source, they hit on things that show, a real commitment.
Things like maybe having a genuine passion for healthcare, for medicine, wanting to directly support the doctors, making a difference for patients.
Exactly those things.
Yeah.
And interestingly, they also mention enjoying the admin side, the organizational parts of the job. That's actually quite important. It shows you to understand it's not just patient interaction. There's all that essential behind-the-scenes work too.
Right, keeping things running smoothly. Which leads perfectly into question 5, which is right at the heart of it. How do you stay organized and manage your workload?
Yeah, this is fundamental. Can't really function without it in this role. A disorganized assistant, well, it can throw everything off. So they're looking at your actual systems, your habits, the source, some really concrete techniques.
Like what? Keeping a detailed to-do list. Prioritizing things constantly based on urgency. Checking the schedule regularly.
Spot on. Really practical stuff. And they also mention using tools, calendars, reminder apps, whatever works. And again, that communication piece comes up, talking with colleagues, talking with supervisors. It kind of reinforces that being organized isn't just about you. It's about making sure the whole team is on the same page.
Okay, the last question they highlight. And this one feels maybe the most critical, certainly from a legal and trust standpoint in healthcare. How do you ensure patient confidentiality?
Oh, absolutely non-negotiable. Yeah.
Hmm.
Any slip up here is serious, very serious. The source outlines the key actions, the things that show you really understand how important this is.
Like always following the clinic's policies to the letter, being super careful about logging out of computers, keeping paper files locked up, only sharing info with people who are actually supposed to get it.
Precisely, all of that. And the suggested answer also includes um, a commitment to keep learning, like regularly going to privacy and security training. That shows you're proactive, staying up to date on how to protect that sensitive information.
It's interesting, too, how these questions are sort of presented as part of this bigger thing, the Kaplan Community Career Center.
Right. The article itself is just one resource they offer, yeah, to help people looking for jobs. They mention other tools on the platform, too, things like an interview coach or an offer analyzer, just names, but gives you an idea.
And they also list similar jobs, right? Like certified medical assistant, health unit clerk, showing that these kinds of questions, or at least the skills behind them, apply across several roles.
Yeah, it gives you a sense of the whole, ecosystem of support they're trying to provide for job seekers in these healthcare support fields.
So, okay, let's wrap this deep dive up. What we've pulled from this Kaplan source is, well, it's a really clear guide. It flags some absolutely key interview questions for clinic assistants. But maybe more importantly, it shows the kind of answers that signal you've got the right skills, the right attitude, and you actually understand the job's responsibilities.
Definitely. The answers they suggest, they keep coming back to things like staying calm under pressure, being super organized, communicating clearly, and that unwavering commitment to patient privacy. It's not just about skills. It's about the underlying values and behaviors you need in healthcare.
And that kind of leads to our final thought based on this. Think about how these questions, they seem simple on the surface. Tell me about yourself. How do you organize? But they're actually digging much deeper. They're trying to get at not just what you did, but how you operate, how you handle complex situations, how you react to stress, how you juggle priorities, and maybe most of all, how seriously you take that patient trust. So, what does that focus on behavior and values really tell us about what it takes to truly succeed, not just get hired, but succeed in these vital support roles? Something to really chew on as you prepare.